Hello.
Hi, I'm Brianna. I'm your student nurse for today, and I'm going to teach you about your prednisone. Is this a
Okay.
good time?
Mm-hmm.
Okay. Can I get your name and date of birth?
My name is Miss Arthur, and my birthday is 4/20XX.
Okay, I'm going to perform some hand hygiene. Okay, so like I said, today I'm going to here to teach you about your prednisone.
Mm-hmm.
So this is because we have determined that you have an impaired memory related to your medication regimen, as evidenced by you saying you forget to take your pills.
Yeah, I do.
Okay, so some short-term goals for today. I want you to be able to verbalize why it's important to take your medication, and I want to, by the end of today, I also want you to be able to identify resources that you could use in helping with your memory. And I also want you to come up with a method or system in order to help you every day. Remember to take them every day.
Sounds
All
easy.
of those by the end of today.
Okay.
Okay, so before we start, are there any cultural considerations I should be aware of?
Nope.
Okay.
None.
None? Okay.
All right.
So I know you have rheumatoid arthritis. That's why we're taking the prednisone.
Yep.
So you might have issues opening the caps on some medications.
Yeah, I do.
Okay,
It's very hard for me to do that.
Okay, so we can talk to a pharmacist about getting the arthritis-friendly, easy open caps. How does that sound?
That sounds perfect.
Okay. All right, so the generic name of this is prednisone, but the brand name, you might see it as Rayos.
Okay.
Okay? So what it does, it's an anti-inflammatory, so it suppresses the inflammation. So therapeutically, it should relieve the inflammation and redness in your hands from your arthritis flare-up.
Okay.
Okay, some side effects you might see from this, though, are hypertension, hyperglycemia, a headache, restlessness, GI upset. And if you notice any black or tarry stool or bloody, you need to notify your doctor right away.
Okay.
But to minimize the GI upset, you can take it with food or milk
I could do
or
that.
things like that.
Yeah, that can't be a problem.
And but foods you want to avoid, you don't want to drink grapefruit juice. Avoid NSAIDs like ibuprofen, aspirin, things like that. Okay, and according to your prescription here by your provider, you're going to take 80 milligrams for 5 days,
Okay.
then 60 milligrams for 4 days,
Okay.
then 40 milligrams for 4 days,
Mm-hmm.
then 20 milligrams for 4 days, and then 10 milligrams a day.
All right.
I know it seems like a lot to remember,
That is a lot.
but the reason the doses change is because you can't stop this medication abruptly.
Mm-hmm.
It can cause like adrenal problems. So you can get like hypotension, hypoglycemia, feel fatigued, nauseous. So
Okay.
also mention any of them to your doctor, those side effects. Okay?
Okay.
So other than not stopping abruptly, and also keep it where you can remember to take it every day.
Okay.
Okay, so do you have any questions so far?
No, I think I'm okay.
Okay, so what's something we believe you can do to, like a method to help you remember taking these medications?
Well, I guess I could set a timer for the morning to take my
Take it?
medicines. Yeah.
Are there any, like community resources or just any resources in general you can use?
I guess I can call my daughter to help me. She
Your
only
daughter?
lives next door. Yeah.
Oh, well, that's good.
Yeah, she could probably help.
Or even those, like the pill containers, like the counters, like the Monday, Wednesday, Friday.
Oh, yeah, she could fill it for me.
They're
Yeah.
easier to see. You will see it
Mhm.
every day. And so why is it important that you stick to this medication regimen?
So that the inflammation in my hands goes down.
Goes down?
Yeah.
Because it hurts and you can't use them.
It does.
Okay.
That's why I don't take my pills. It's too hard to open it, and I don't remember. And
Well, hopefully we can get the easy open caps.
Mhm.
And hopefully the timer and seeing the layout with that kind of storage
Mhm.
will help you. And, your daughter should be able to help. But I think it's really important that you set a timer and try to remember to do it yourself.
Oh, I could do that.
Okay. Any other questions?
No, thank you so much.
Okay, you're welcome. Hi, I'm Brianna. I'm your student nurse. I'm going to teach you how to use your heparin. injection at home. Can you tell me your name and date of birth?
Joan Arthur 420XX.
Okay, I'm going to provide privacy for this teaching. Okay, are you ready to learn today? Is this a good time?
Yeah.
Okay. Okay, I know you have the rheumatoid arthritis and your hands can get a little stiff. So today I'm going to observe you give a heparin injection and we can identify spots that are easier for you to access. Okay. Okay. Excuse me. Your medication, the generic name is heparin, but your brand name, you might hear it called Heplock. Okay? Your dosage is going to be 5,000 units, okay? So on a syringe, you're going to want it either measured in units or milliliters. Today I have one in milliliters, and you're going to draw it up like this. You're just going to pull it out to the 0.5. That top part of the syringe, the plunger part, lines up with the 5. Do you see?
Yes.
Okay. Because 0.5 milliliters equals 5,000 units. Okay. So you're going to have this injected subcutaneously, which means it goes into the subcutaneous layer of your skin. And when you're doing a sub-Q injection, you want to use a 25 to 27 gauge needle. Okay, so the supplies we're going to need for this, we're going to need some alcohol prep pads. You're going to need your heparin. And for today, we're going to use an Injectipad, but in the future, your stomach or your outer thigh would be preferred sites, and every time you do inject, you're going to need to pick a new site. Okay? All right, so I'm going to perform hand hygiene. Put on some gloves. Okay. Now before you inject, you're going to take your alcohol swab. You're going to take one of them and clean your skin like this. Okay. And just let it dry, don't blow on it. And then you're going to take another swab and you're going to clean the top of the vial of heparin and do not blow on it. Okay. So then while they air dry, you're going to inject 0.5 milliliters of air into the syringe. So you're going to pull it down and stop where that top plunger is at the 0.5. Okay, and then you can take the cap off and you're going to inject it into the vial, hold the vial, put it like that, and then push, don't just stab it. And then you're going to inject the air back into the vial and then flip it upside down like this, and you're going to inject 0.5 milliliters again, but this time of the liquid, or of the heparin. Okay, and that top plunger matches the 5. And if you have any air bubbles, you're going to hold it like this and then flick the syringe until they are out and up the top. And you can keep redoing that as many times as you need to. So then, take it out, and you're going to inject this at a 45-degree angle. So you can think of it as 90 and then 45, it's about half of that. You're going to pinch your skin and you're going to put it into your skin like a dart, okay? So 1, 2, 3. And then once it's in, you can release and then inject slowly. Okay. Okay, and then at home, to dispose of this, to recap, you're going to scoop it up and put the cap back on, and then dispose of it in a sharps container at home. At home, after you inject, you want to watch for any bruising, bleeding, redness, tenderness, anything like that. Okay, now would you like to teach this back to me?
Yeah. So I do some hand sanitizer on my hands. I take an alcohol swabby and I take it and I clean the skin off. And then I take another alcohol swab. I clean the top of the heparin. Rub it real good. And I take the syringe and fill it to 0.5. Uncap it. Push it into the top. Inject the air. Flip it over. Inject the heparin. Fling out any air bubbles and redo it so I don't inject any air into my old self. Flip it back over. Pull it out. Pinch my skin. Hold it like a dart at a 45-degree angle. Dart it in. Let go. Push it in. Slowly. And then inject it out. Then I take this and put it in a sharps container.
That's very good. Do you have any questions?
Nope.
All right, thank you.